Hello everyone, and welcome back to the ISNTD Festival. We've had a really engaging and packed day so far, looking at all things creative and how they can be applied to neglected tropical diseases and scientific research in infectious diseases more broadly. It's been a really great morning, really thinking about the movement and advocacy of tropical diseases from local to global. How can we better understand affected communities? How can we better share research and policy interventions, and already exploring quite a few really lovely and fascinating approaches, all the way from animation to a song and a dance, a film, and so forth. So it's my pleasure now, after everyone's had what I hope was a lovely lunch break, to start the afternoon off. We're going to dive into a little bit more of a technical angle, a viewpoint onto tropical diseases, research, scientific research, and how can that best be shared? How can that best be communicated? And so in this session, we're going to go beyond numbers, the science and art of storytelling through data visualization. So it's my absolute pleasure. I can't wait to unpack and discover everything that our speakers have to share with us today. Three very different but fascinating approaches. And so to our audience, I'm sure you will join me in welcoming very warmly our three speakers this afternoon. We will be hearing firstly from Angelica Garcia. Welcome, Angelica.
Hello, everyone.
Hi, you are joining us from Manila in the Philippines, and you'll be representing the Ateneo Center for Computing Competency and Research and talking to us about how data visualization impacts decision-making for public health. Following your talk, we'll dive a little bit deeper into the software and the approaches and all the different strategies out there with Professor Paula Moraga. Welcome, Professor Paula.
Thank you.
Hi, you are Professor of Statistics at the King Abdullah University of Science and Technology in Saudi Arabia. Thank you so much for being here. And joining us from the University of Oxford's Big Data Institute, we will then hear from Christopher Ho. Welcome, Christopher.
Thank you.
Hi, and you'll be talking to us about the use of maps in community engagement with examples from SchistoTrack, the project in schistosomiasis. So thank you so much to the three of you for joining us today and for being here. Very warm welcome as well to those in the audience. Don't be shy. If you're online, please put a message in the chat. Let us know who you are, where you're tuning in from, and if you are working at all in data visualization, any links or anything you'd like to share or comment on over the next 90 minutes as this session unfolds. So on that note, without any further delay, I'll hand over to you, Angelica. We look forward to hearing from you with some really important and very useful insights into how data visualization can support public health decision-making. So thank you to everyone for being here. Over to you.
Hello, everyone. I'm Ange, and today I would like to share with you my experience in surveillance, specifically on how data visualization can help inform public health strategies. Next slide. All right, to start off, here's the outline of my presentation. First, we'll go over the phases of data analysis and then move on how data analysis looks like with the public health surveillance context in mind. Here, we'll focus on data visualization, where I will share some tips and real-life applications. And finally, ending with some key takeaway. Here, I have detailed the phases of data analysis according to Google, which starts with asking the right question. So in this step, it is important to understand what our stakeholders need. Once we have clearly defined our question, we then proceed to preparing or collecting the data that we need. And more often than not, the data that we collect won't be organized. So there would be a need to process or specifically clean and transform the data to a format that can be easily that can be easily analyzed. Then in the analysis phase, we would need to try and find relationships and patterns in our data. And afterwards, we are now ready to package the information into something that can be easily understood by our audience. And this is the focus of the share phase. This is also where we can utilize different data visualization techniques to ensure that the intended message is relayed. And finally, we hope that given all of the analysis that we have performed, we are able to provide recommendations so that our stakeholders are able to act accordingly. So we all know that data analysis is being used in different fields. But for my presentation, let us focus on public health surveillance, whose goal is to provide information that can be used to guide public health policies and programs. Now, let us go through to each phases of data analysis in the context of public health surveillance. So for the ask phase, I have listed here some of the usual questions that our decision makers in the public health is posing. So one would be about trends of cases. Are the cases increasing? If yes, where? In what region or locality? And this can be also associated to where the focus of resources will be allocated to. Another can be in terms of monitoring and evaluation. So program managers usually wanted to know if the interventions that are being implemented is effective or not. And lastly, public health decision makers would also want to know who are most at risk of a certain disease or condition. Now, given that we already know the questions that we want answered, we are now ready to collect the relevant data that we can utilize. So in terms of surveillance, we collect data through dedicated information systems or electronic medical records. Case information comes from different sources including hospitals, clinics, self-reports, laboratories, and local government health units. So in the Philippines, we have a set list of notifiable diseases which are required to be reported to the government as part of surveillance. So this serves as the main source of the data that is being analyzed and used to guide policies and programs in the country. So now I would like to move forward to the analyze phase. So let's just skip the process phase since that would entail a whole discussion in itself. So assuming that the data has been processed, we are now ready to perform the analysis. So for this part, I will cover only descriptive epidemiology, which would entail analysis in terms of person, place, and time. So these are the examples of analysis describing a person. So we can look at their health outcomes, severity of the disease of the patient, vaccination status, or even their race and ethnicity, their occupation, sex, and age. So for analysis in terms of place, we can look at clusters of cases, which is defined differently depending on the disease and is also a function of time and place. Another is checking which area within a country is most affected, or comparing cases across different countries, or maybe checking if there is a localized appearance of the disease. So lastly, in terms of time, we can examine the trends of cases over time, see if there's a seasonality or a specific time period wherein cases are usually increasing or decreasing, or as I have mentioned earlier, look at clusters of cases. So now, after doing all the hard work of collecting, processing, and analyzing the data, the next step is to transform all of these into something that is digestible to our decision makers, which is part of the share phase. So there are different ways to share or communicate our findings through data products such as full reports or shorter ones like bulletins or dashboards. And I also wanted to emphasize in this part that the type of the product that we design differs based on the audience. So based on my experience in COVID-19, our decision makers don't have much time to read lengthy reports or full or all that full paragraph of analysis that we have written. So that is why usually we prepare slide decks showing tables or visualizations guided by a banner statement that details the main point of a specific slide. Yeah, but what is data visualization? So, data visualization is a graphical representation of data, and that is aimed to facilitate understanding and communication. So, this means that visualizations should accurately represent the underlying data to avoid misinterpretation. And why do we need to visualize data? So as I have mentioned earlier, there are instances wherein the decision makers have limited time to process the data, for example, in tabular form. So this is where data visualization can help as it allows us to reason and think effectively and for me efficiently about the data at hand. Also, visualizations can help amplify the key points that we want to relay in a certain data story. So given that, let me provide some tips. So first, you must begin with a goal in mind. So let's look at the example on the right, which is a graph showing the number of cases and case fatality rates or CFR. So CFR is computed as the number of deaths among cases per age group of a certain disease. So part of the work is to determine the goal of the analysis. So in this case, it is to examine the relationship between age and risk of dying. So given that, one possible way is to show how the risk of infection through the number of cases and risk of dying through the CFRs differ as represented by the bars and the line graphs respectively. So with this, we can easily see how those among vulnerable age groups or those younger children or older age groups have higher CFRs. And as I have mentioned earlier, we use data visualizations to facilitate understanding. Hence, good visualization are usually intuitive and can speak for itself. So this can help our audience think efficiently. So to provide an example, I have here the map of US showing tuberculosis cases in 2022. So here we can easily deduce, also with the help of the legend, that the areas with darker shades have higher incidence. This emphasizes how we can use colors or formatting strategically. And for this example, at first glance, we are drawn to the parts of the map where the color is darker. So, which for decision makers can be the areas where they can focus their resources or public health response to. But for instances wherein the message that we want to convey is equally complicated, we won't be able to fully simplify our visualization. So in this case, we need different helpers to provide proper context. So let's examine this sample visualization. At first glance, I'd say that there are many things going on. But through the different elements accompanying the graph, so first, we can see the narrative at the top that summarizes the key message, the table title, and the label, which describes what data is presented, plus the annotations, which detail important information to consider. Given all of these, we are able to get the message of the visualization. So, which is to show how fast the number of COVID-19 deaths are increasing in different countries. So, based on the annotation in the graph, we can see that the faster the rate of increase, the steeper the lines are. So aside from the context, we also need to be transparent of the caveats and limitations and uncertainties with the data that we have. So to illustrate, the sample visualization on the right shows the composition of COVID-19 cases in terms of disease severity, which is represented by a triangle. So this tells us that the closer we are at the bottom part, the larger its contribution. We can see how the top of the triangle shows the deaths, while the bottom shows the mild cases, which is composed of over 80% of the cases. But at the lowest part of the triangle, we can see a note indicating the cases that were not identified or not diagnosed. And this was represented by a portion of the figure that looks like fading, and it represents the uncertainty around the data at hand. Next, okay, it is also essential to clear the clutter. So suppose that I wanted to look at the trend of COVID-19 deaths in different countries during the first 2 years of the pandemic. So given this graph that I generated through our world in data, we can examine the trend, right? However, it would be very difficult to assess each country's data given that the line graphs overlap. So to clearly see the trends, I tried to resolve the problem by first grouping the countries based on the range of their deaths data. So this can help us see clearly how the trend of deaths look like even for countries with relatively lower numbers. Next, I also limited the date range to cover only 2020 to 2021, as this was the specified date needed for the analysis, and this helped us focus our attention to the most important data points. And finally, we also need to be inclusive. So this means to take into consideration a diverse audience, which can include individuals with disabilities. So one aspect to look at is our choice of colors. So there are multiple sites that provide suggested color schemes considering color blindness. So in this slide, I noted two. So first is the brewer2.org and the coolers.co. Okay, to summarize the points that I have shared, so we should begin conceptualizing with a goal in mind. And remember that a good visualization is usually intuitive, but depending on what you need to communicate, it can be a bit complicated. Regardless, we need to provide proper context and be transparent of the caveats to avoid misinterpretation. Clear the clutter to ensure clarity and be inclusive so that everyone is able to get your message. Also, noting that visualizing data is an iterative process wherein you would need to refine and improve your output based on the feedback of your stakeholders. Now, going back to the phases of data analysis, after we share our findings through data visualization, it's time to act. So let's move on to some real life applications of how data visualizations were used to inform public health actions. First, I have here John Snow's map. So John Snow is actually widely considered as the modern father of modern epidemiology. And this map is one of the things that he is famous for. So he used this map to investigate the source of a cholera outbreak in London, which ultimately helped them understand the transmission of the disease. So let's begin examining the map. The bars that we can see per area represents the deaths from the households. We can also see here that the location of the pumps are also noted. Now I have listed here some of the questions that Snow tried to answer during his investigation. And the answer to all of these questions singled out a specific pump, which is the Broad Street pump. So looking at the map, he saw that there were higher number of deaths around the pump along Broad Street. So he then tried to do interviews and found out that the primary source of water of the household in the area is also the Broad Street pump. And to now confirm that the Broad Street pump was really the source of the outbreak, Snow gathered information on where the persons with cholera had obtained their water. And he noted that the common factor among the cholera patients was the consumption of water from the same pump. So afterwards, he presented his findings to the municipal officials, who then decided to remove the handle of the pump. And afterwards, the outbreak ended. So finally, we have different dashboards during the COVID-19 pandemic. So publicly available dashboards of the Johns Hopkins University, WHO, CDC, and the Philippines are just some of the many dashboards that were built during the COVID-19 pandemic, which also aim to inform the public with latest statistics. So for this instance, I wanted to emphasize that public health decision makers are not only coming from health units, but also includes the public. Having publicly available information during the pandemic helped and empowered the public to make their own risk-based decisions. Okay, now to end my presentation, I'd like to quote Spider-Man, with great power comes great responsibility. Therefore, we should visualize responsibly. Thank you very much, everyone. So I just listed here the sources of the slides, the visualizations, and some book references. Thank you very much.
Thank you so much, Ange. You were talking about removing the clutter, and I think you did exactly that by really giving us such a clear and streamlined presentation on how and why data visualization is important in public health decision making. Some great examples there around the COVID pandemic. So thank you so very, very much. We'll now hand over to Professor Paula Moraga, who's going to take us into the detail of this visualizations and to some of the tools, some of the really exciting tools and also resources where you can build and develop your knowledge and skills in this field. Paula, thank you very much. Over to you.
Thank you so much for the invitation. It's a pleasure to be here and be able to speak about my research. My name is Paula Moraga. I'm an assistant professor of statistics at King Abdullah University of Science and Technology, known as KAUST in Saudi Arabia, where I'm also the principal investigator of the GeoHealth Research Group. My research focuses on the development of statistical methods and computational tools for geospatial data analysis and health surveillance. I have developed methods to understand spatial and spatiotemporal patterns of diseases such as malaria in Africa, leptospirosis in Brazil, and cancer in Australia. And I've also developed a number of R packages for baseline disease mapping, detection of clusters, and risk assessment of travel-related spread of disease. And I'm the author of the books Geospatial Health Data and Spatial Statistics for Data Science. These books are published by CRC, but they are also freely available online and help researchers develop solutions for health and environmental problems. My first book, Geospatial Health Data, Modeling and Visualization with Arilla and Shiny, was published in 2019 and has been translated to Chinese. And it covers how to manipulate and transform spatial data and how to create maps using R. It also shows how to fit and interpret Bayesian spatial and spatiotemporal models using ILLA and SPDE, and how to create interactive visualizations, reproducible reports, dashboards, and Shiny web applications that facilitate the communication with collaborators and policymakers. My second book was published last year, Spatial Statistics for Data Science, Theory and Practice with R, and it covers spatial data types, retrieval, manipulation, and visualization, and a number of statistical methods and models to analyze aerial data, geostatistical data, and point patterns. So today, I'm going to give a short overview of geospatial data and methods, and then I will talk in more detail about my work on interactive applications for communication. In spatial epidemiology, we distinguish three types of data: aerial data, geostatistical data, and point patterns. In aerial data, we have the region of study that is partitioned in small areas, and in each of these small areas, we have the number of cases, the population, and risk factors. And our objective is to predict the risk of the disease in each of these areas. So we can use models that allow us to include covariates to quantify risk factors, and also random effects to account for residual variations such as spatial autocorrelation. And then it's also very important to visualize the results. R has many excellent packages for static and interactive visualization. Here, for example, I'm showing a map that was produced with the package Leaflet. This is an interactive map where we can zoom in, we can zoom out, and then we can hover the mouse over the areas to see the information corresponding to each of the areas. When we work with geostatistical data, we are assuming that the risk is a spatially continuous surface that can be measured at specific locations. For example, here we are measuring the risk or the prevalence of lymphatic filariasis in these specific locations. And our objective is to predict what is the prevalence of lymphatic filariasis, or the disease that we are studying, in areas that are not sampled. And we will use the data collected and also covariates and information that are known to affect disease transmission. And finally, in point patterns, the data are the locations of people that have the disease. It's the same as Angelica was showing the map of cholera of Jon Snow, where the bars corresponded to the locations of people that died from cholera. And our objective is to predict or to understand what is the process that originates this data. Is this data at random? Are they clustered? Are they close to a contamination source? So in addition to my work on the development of statistical methods to analyze aerial geostatistical data and point patterns, I also develop software so my methods can be widely available and provide benefits beyond my own applications. For example, I'm the author of Spatial Epi App. This is a shiny web application for disease mapping, detection of clusters, and interactive visualization. So here the user can upload the map, the data, and then by clicking some buttons, they can obtain disease risk estimates using Bayesian models. They can also detect clusters, and then they can visualize the results using interactive maps, time series plots, and interactive tables. And they also have the option to generate reports with the analysis conducted. I'm also co-author of a package called EpiFlows for risk assessment of travel-related spread of disease. As you know, infectious diseases may spread beyond national borders. People living in one location can go abroad and infect people abroad. People that come to the infectious location for holidays, for example, can get infected, and when they return to their home countries, they can infect people in their home countries. So this package implements a mathematical model that predicts the number of cases that could be spread to other locations from an infectious location together with uncertainty measures. I'm also interested in digital health surveillance. Surveillance systems are critical to the early detection of epidemics and the design of control strategies. But traditional surveillance systems have a limitation, and is that information is delayed. From the time that the person gets sick to the time that the person decides to go to the doctor, goes to the doctor, have the laboratory tests, and that information is in the system, it may take a few weeks. So this information is not useful for taking action in real time. Nowadays, we have access to other types of information, such as social media data, where people chat about how they feel, or Google searches, where people search treatments for their conditions. And this information is not produced for epidemiological research, but we can use it to understand disease activity levels in real time. We also have access to demographic and environmental risk factors such as temperature, precipitation, humidity, and many climate-sensitive diseases are affected by these factors such as dengue or malaria. So we are working on a digital health surveillance system that integrates multiple data sources to produce local probabilistic predictions of disease activity in real time, and also an interactive dashboard that alerts public health officials when elevated disease levels are anticipated. So this application will include visualizations that allow us to explore data in an interactive and approachable way, for example, using time series plots or interactive tables where we can sort the columns or search a specific word. And we can also use interactive maps that allow us to overlay health data, risk factors, political boundaries, and other geospatial information that is useful to put data into context. For example, now we are working on Dengue Tracker. This is a system that provides weekly updates on the number of dengue cases per state in Brazil. So here we present the official cases, but as I mentioned, these official cases come with delay. So we also provide corrected case counts, incorporating information from Google Trends. And we hope that these reports assist policymakers and also the general public in understanding dengue levels and guide their decisions. So before finishing, I would like to mention that I'm looking for PhD students to join my group at KAUST. So if you are interested in learning and working with me in statistical and computational methods for health and environmental applications, please get in touch. And these are some references about my work, including my books, Spatial Statistics for Data Science and Geospatial Health Data, if you want to learn more about how to analyze spatial data and applications in health. And that's it. Thank you very much.
Thank you so much, Paula. Wow, absolutely fascinating, incredibly useful, practical applications. Thank you, really building on what Ange shared with us. And we'll be sure to also look at those amazing resources, the 2 books that you've shared with us.
Thank you.
I hope you will get a very strong and positive response to your call for students as well. So thank you for that. Really great presentation. We'll hand over now to Chris for drawing all the things that we've heard from Ange and Paula and really applying this to a very specific project. So it's a pleasure to welcome you, Chris, and we look forward to your to hearing all about your work.
Thank you.
Thank you.
I'm Chris. Thank you for having me. And today I'm going to talk about how we visualize data using maps to communicate study findings to different stakeholders surrounding the SchistoTrack cohort. So SchistoTrack is a longitudinal cohort based in 3 districts of rural Uganda, run in collaboration with the Uganda Ministry of Health. The study areas feature diverse ecologies around the Nile, Lake Albert and Lake Victoria, and different water landform types. Additionally, there's diverse populations with different behaviours, water contact activities, and access to water sanitation, hygiene infrastructure, and healthcare. So over the past 2 years of SchistoTrack, we've used maps for a variety of purposes, including communicating risk of schistosomiasis infection, and this has included talking to local governments and visualising infection statistics and prevalence across the rural regions to inform mass drug administration efforts. We've also held community engagement activities with the SchistoTrack communities involving presenting our findings from the collected data. We also use maps to assess levels of infrastructure access across the districts, mapping the shoreline and how it changes over different seasons, and building capacity among wider SchistoTrack and Uganda Ministry of Health teams by hosting interactive software workshops. So these maps display water sites, taps and latrines in the study district, and were requested by Judith Kigesi, the PACWatch Environmental Health Officer, where PACWatch is one of the 3 study districts. The maps were used to inform people of locations to target for cleanup activities as part of World Wash Day. And districts can also use maps like these to understand the distribution of wash infrastructure and subsequently advocate for additional resources in locations where these resources become out of use or needing to be improved. Ensuring that maps suit your audience is an important consideration when presenting data visualizations in this way. And this map shows water sites that are keyed by their infection status with the snail intermediate hosts. We'd originally planned to show these in community engagement with the study populations, but we decided against it because in the red box at the bottom, you can see it shows an infected site right next to a non-infected site. And knowing that the distributions of the snails can change, especially across seasons, we wanted to avoid giving the message of certain sites being safe to visit when this is not always guaranteed to be the case. During community engagement, lots of questions were asked regarding how contact with water impacts the risk of schisto-infection. So Fabian Reutzig, who's a PhD student in our group, his research focuses on analysing individuals' contact with water and associating that with schistosome infection. And so participants from the study were given wearable GPS devices to trace their water contact, and this was used to gain more understanding of water contact frequency and duration associated with different vocations and recreational activities, and relating this back to risk of infection. So the example on the left shows an adult woman with no water contact, and on the right is a 15-year-old male who is engaged in fishing. These maps are used to understand how the shoreline can change across years and across seasons. And they're from Dr. Melissa Yakovidu's research. And so the dots show water sites across the years from January 22, Jan 23, September 23, and January 24, where the GPS coordinates were recorded by malacologists working in the study. And so it shows that the sites can move depending on rainfall and flooding, and also that the water sites at the shoreline don't align perfectly with the satellite imagery. So this shows that it can be difficult to use satellite imagery to accurately predict site characteristics and snail area distribution, and snails are more likely to inhabit standing water areas along the shorelines. Lastly, due to the importance of data visualization and advocacy, we also build capacity. And as part of this, we hosted a QGIS workshop last year, which is a free open source software for building maps. And the aim was to enable malacologists and technicians from the Ministry of Health to create risk maps integrating satellite imagery. And so this workshop was hosted by the SchistoTrack team, and the outcome was that they used these maps to map out mass drug administration levels by administrative region for use in national program reports. Thank you for listening to these examples. This slide just shows our acknowledgements, everyone who's in the team and the Ugandan team and has contributed to the projects. Thank you.
Thank you, Chris. It was a great example of really the whole continuum and spectrum from in-field data and all the way to visualization, collating this for public health policy, but also some really nice examples of capacity building along the way, which is really where Ange started, which was to really show us, and as well as Paula, what to do, where to do it, where the resources are. So a very, really insightful, interesting trio of presentations. Thank you very much. Fitting into that umbrella of how do we communicate better about something as complex and heterogeneous as big data sets when we're trying to attend to public health problems. So thank you to the three of you. I suppose that one of the things that spring to mind, since we are in a creative forum today, slightly more than a scientific one, is as scientists, so how important do you feel it has become to really make the data so accessible and appealing? Is that appeal sometimes lost at the cost of what's the data's really important for? Do sometimes the media or the public or a wider audience kind of pick out parts of data that are not always the most relevant parts? So where's the trend going in terms of data visualization and sharing data? I suppose, I don't know if someone wants to jump in first or if we can go in order of presenters, it's up to you.
Well, I can start. Yes, so I think like data visualization is super important in science. For example, I'm in academia and we conduct a statistical analysis. We have our results and then we usually write a paper that we publish in a scientific journal, and the paper stays there and is read by other researchers in the field, but it doesn't reach like the general public or people that really needs to take action, that needs to take the results and really do something for improving the health of the population. So I think like by having our results visualized in interactive maps, for example, dashboards, that's really helpful for people to understand and is very good to communicate our results in an easy way. And then all of these results can be used by decision makers to understand what are the high-risk areas, what areas need more resources, what are the most vulnerable groups, and also for the general public that needs to be informed about disease risks. So I think data visualization, and nowadays with all the tools that we have available, we can do it, and we need to do it to reach the population.
Okay.
So hello, yeah, I'd just like to add that in the perspective of those who perform the data visualization, so as I have mentioned earlier, we must be able to visualize responsibly because the people we visualize. So for example, the data products that we produce, usually we don't we focus on graphs or charts instead of using tables for the general public to be able to understand what our message is. So I think it would be very important to have a clear goal on what we want to communicate so that the message won't be lost in translation.
Chris, would you like to add anything to that?
Yeah, and I think just to build on that, data visualization, I think, can be incredibly important when you're trying to communicate statistical findings to a less technical audience, perhaps, whether that be in advocacy or in concentrating efforts of drug administration. I think once you've got the statistical models and research that show why certain activities or lack of infrastructure might be associated with negative health outcomes, once you can present that data in an interactive and digestible way to the policymakers or governments, I think that's really important in working towards improved health outcomes.
And do you find that appetite has been growing increasingly as the general public becomes much more involved in public health thinking? And is there anything that can be done to, are there gaps or challenges where you see you would love to do more, but there's you would like to see more resources put into it, or perhaps groups collaborating more to create super dashboards?
Yeah, I think forums like this are great for hearing about other people's work and seeing what other resources out there available, whether it be books, training courses. Because I think, yeah, with it becoming increasingly more in the public domain, I think being able to find out about what resources are available to you and your group and to work with other groups, I think is, yeah, definitely a really important thing.
How about
Also,
yeah?
also, so now that we are able to collect a large volume of data nowadays, so I think it would be very important to have like analysts who would be able to um, uh, transform all of these data into something that is digestible. So having those capacity building available for say employees in the government or at the academy would be very helpful. Thank you.
That's a really good suggestion, definitely.
Yes, and I also think that we need to increase the access to open data, because we have a lot of data that is collected by health registries, by several institutions, but sometimes this data belongs to them and they don't share the data, and maybe if they share it, it could be better for all, because there will be people that will be able to take insights from that data and then share with others. So I think that we could also improve the access to open data and how this is shared with others.
Yeah, that's that is the next frontier, I guess. And so our audience is quite diverse, and so it's quite possible that something like R or Shiny is just a very mysterious concept. So would you be able to explain just in very simple terms what that software is? Why is it so amazing? Because everyone is really getting on board and using them, and maybe what's missing or what might be the next iteration of these packages.
Yeah. So, for example, in my case, I use R for statistical analysis. So R, a few years ago, had several functions to conduct statistical analysis and very simple plots. But nowadays, there are many excellent packages for visualization, like the maps that I showed, time series, tables, and these visualizations are really can be done like with a couple of sentences of code. Like there's no need to be a computer programmer or anything. Like it's very simple if you want to learn. So as I said before, R is a statistical software that is free, is open source, so everyone can go to the website, download the software and use it. And then there are many resources to learn how to use R. There are like blog posts, there are videos, there are online books that people can utilize to learn R, and then also many examples of visualizations if they are interested in doing something like a map or a histogram. They can go to the examples and look at the code and then change the code according to their needs. So I think it's a great software for data analysis and for visualization. And Shiny, R Markdown, Quarto are just packages of that software.
And I'm just putting the link in the chat, but you did give a very useful talk called Adventures in R and Predictive Artificial Intelligence for NTDs and Global Health. Here at ISNTD, it's already more than 2 years ago, but very relevant and a great resource. If anyone's interested in that, I will post the link, sorry. Ange and Chris, are they packages that you use as well? Do you love them?
They are what everyone in my group uses as well.
Yeah.
Especially there's this one on R called Leaflet that Professor Moraga talks about. And yeah, it's very simple to use. Just with a few lines of code, you can add in different color coding of regions and different satellite imagery. And yeah, it's super easy to get it off the ground, interactive maps.
So I think from my end, the visualizations that I usually generate are a lot simpler than what Paula and Chris is doing. So I usually use spreadsheets to visualize the data that I have. So I think for those who are might be intimidated with coding, they can also utilize spreadsheets because there are a lot of available charts that they can use there to visualize their data as well. And also, some of the more advanced are Tableau or Power BI, where they can just upload the data and then drag and drop so that the data would be loaded in a visualization that they are choosing.
That's great. And well, I'm sure you are all aware, but there's also a huge proliferation of companies and design studios that are really specializing in data visualization and helping all sorts of parties to really present themselves and their work and their data in extremely appealing ways. Do you feel that the science community needs to engage a lot more with that polished finish, that artistic look, or is that not necessary at this point? Given perhaps how maybe funders might be looking at projects, or more generally, maybe governments, policymakers, like, is there really a case now that the tools and the software is moving really fast? Has the bar been set higher?
Well, I think that it depends on the particular case. Like, some people will be happy with a simple visualization that still is effective, but other people will prefer to make it more pretty. So it depends. But yeah, I think that with all the progress that we have been seeing, like in a few years, the visualizations, the interactivity will be even better. So, and it will be easier to do such visualizations.
Chris, you seem to agree.
Yeah, definitely. I think also collaborating with people working in scientific communication and design is definitely important to get your research out to a wider audience, and especially when it's been presented in media, news, and government reports. I think, yeah, essentially, definitely making your visualizations attractive and digestible is a hugely important thing, for sure.
Thank you. And you've worked really at the interface between the data and the policy making, and yeah, is there a move towards really? We've seen that. The reason I'm mentioning it earlier today, especially when it comes to film, for example, in public health, in global health, the quality of the films have increased incredibly. Even a 5-minute film is meant, a lot of them are beautifully produced. It's actually got a storyline. It is really a piece of art almost. And so will data visualization be going that way as well, do you feel?
I think yes, because we would need. So my experience is I have been working with the government during the COVID-19 pandemic, and we saw the great importance of how we visualize data, because usually the stakeholders are not, the decision makers are not usually public health, might not be a public health person. So we have stakeholders like from the different department of the government. So we need to be able to convince them and provide them the message that we wanted to convey. So having those visualizations helped in communicating those messages. And I think there is a need to develop the skills, that skill in the also in the government setting, and yeah, because it would also help us communicate to the public what we want for public health.
Got it. Well, thank you very much. You've given us some really good insights into how to look at the data, how to work with it, share it, and also, all importantly, display it. And just like out of interest, you're working on very different things. What might be your next steps or next projects that you're looking at, or even a huge wish list in terms of data visualization, working on your data projects? Paula, yeah.
I'm working on the use of new data like digital data sources, social media, Google searches, and I would also like to utilize mobility data, like maybe data on the number of flights between states, so we can better predict the spread of diseases. And it would be also really interesting to see which visualizations are good for this type of data, for these flows of population.
That's really interesting, and it reminded me of a question that came up when you were giving your presentation about sort of the search queries or the social media posts. And do you think that those companies, those platforms will become important partners when thinking about big data in the future, or are they difficult?
I think they have like a treasure. I mean, they have data, they have a huge amount of data, very valuable data of ourselves, but of course it's private, and of course there should be regulations to be able to access that data because it's very sensitive.
Yeah.
But if this data becomes available in a way that is non-identifiable and everybody protecting the confidentiality, I think it would be great. Like, for example, now we're using Google searches. These are like Google Trends indices. Like if you go to Google, you can see like more or less the amount of people that search a specific keyword. But this is like on average for a large number of people.
Yeah.
It would be better if we have more detailed information, because if we have more detailed information, we'll be able to predict better the spread of disease and develop more target information.
Yeah.
And with the social media data is challenging because before, like we could use Twitter for free. Nowadays, if we want to download data from Twitter, we need to pay, so it's more difficult. But I hope, like, if companies are collecting the data that we provide and they are using it for their own benefit, I hope that they also give us our own data for the benefit of all. So I hope that happens.
That would be amazing. And Google did have an incursion at some point into a flu tracker and a dengue tracker, so maybe they are quite open to that notion. As long as they don't have to do the work, they might be a willing partner. Chris or Ange, would you like to add to this?
Yes. So I really agree on what Paula said earlier in terms of having the different data available. And for me, my experiences on using surveillance data in my analysis. So I think it would be, and also accounting for the delays in having those data and collecting those data. So I think having the social media data or different data that we collect to be able to be triangulated to the surveillance data can also help us provide more timely responses to public health decisions for public health decisions.
Mhm. Fantastic.
Yeah, and I completely agree with what the others have said. I think increased availability of de-identified data, timely data, and I think what websites like Our World in Data are doing at the moment is great having that, but I think for that to be expanded onto a larger scale, I think would really kind of encourage and enable more up-to-date and kind of widespread data visualization to really bring that forward.
Thank you so much. I'll just turn a little bit to the audience. So if anyone has any questions, please don't forget, you can put them in the chat. I think it's been a really interesting session because the audience is varied. It's not necessarily a technical audience. I'm sure there would be lots of real detail to drill down in the various uses and function of R, also the differences in different types of visualization and so forth. But I think we're very grateful. It's been really wonderful to have an introduction to what to look out for and some of the future steps in terms of not just the visualization, but the actual data and the collaborations that are needed to make big data more easily available for those in public health programs. So on that note, I would like to ask my final question, which is if you had any last thoughts or last words of advice for anyone who wants to improve their data visualization, their reporting, anything that you might want to suggest or to think about for all those who are working in tropical diseases and want to improve their data visualization.
So I would say, I would repeat that R is great, and I would encourage everyone that wants to start with data analysis and visualization to learn R.
Brilliant. That's a simple and clear endorsement.
For me, I think it's my key takeaway. So we should be able to visualize responsibly and look through the lens of our audiences when we're doing data visualizations. Thank you.
Very important. Thank you, Ange.
Yeah, and I think if I had any tips, it would just be to have a go. Like Professor Moraga said, it's free to download R on the internet. There's free data sets that you can download from Kaggle or Our World in Data, and to just load them in, follow tutorials online, and then you'd be surprised about how quickly you can get something up and running. And yeah, I think that would be where to start, I guess.
Yeah. Great. And it's a wonderful way as well, thanks to social media, just to share a chart, a figure, one aspect of your group's work, and then just to really start to build and accelerate any interest into projects, and from there any collaborations can come. So well, thank you so much. You've given us your time today. We've learned a lot from you. It's been great to find out more, and we look forward to keeping in touch on all your projects. And I think everyone should really go. There's about half an hour before the next session. That's plenty of time to go and explore R. No excuses. And so on that note, we'll also share the link to the 2 books that you shared with us very kindly, Paula. And we look forward to keeping in touch. And unless there are any final questions from the audience, perhaps this is a good time to bring the session to a close, and to thank you once again for your time in sharing all your knowledge and resources with us today.